Staffing issue requires more nurses, more doctors.
Yeah.
I'm a proponent of digitization, but I understand very well that there's certain things at this point in time you cannot replace. And so the conversation that needs to, and that we are having right now, is to say that, look, when we look at this, overloaded healthcare facilities, clinic, healthcare center, Katro Hospital, you name it, what we need to look at is, number one, understanding the situation. So we do a situation analysis. What does that mean? It means, number one, why are there so many patients in the line? So let's start there, because a lot of times we jump on the last side. Let's start first. Why are there so many patients in the queue? First thing is prevention, right? That's the first part. And I love questions that focus on prevention, because I believe that a lot of countries are not focused enough on prevention. So do you need to have continuous bouts of acute gastritis because you continue to have spicy food because nobody's told you that this will cause you to have an attack in the moment, or you continue to have alcohol because nobody has educated you? So what are we doing about the prevention? I'm very particular about that, because I feel, and when I joined the ministry, I kept emphasizing the fact that prevention must be emphasized. And when we educate patients, we educate them in a manner they understand. So it doesn't matter you come and you're using your fancy English to communicate to me about acute gastritis and the acid. I don't understand that. So when you take it into my native language, it allows me to understand. So that's the first part, prevention, health education, and we must focus on that. I keep saying the strength of a health system is not necessarily in just the strength of the hospitals, but it's in the ability of the healthcare system to keep the patients out of those hospitals. And that's a key part that we need to focus on. On the other side of things, so we speak about prevention and we get right into the sector of it and the crux of the matter, and that's the nurses and the doctors. There is no substitute for the fact that if there are 10 doctors, as opposed to waiting 10 hours, I wait 1 hour. There's no substitution for that. And I've been a very strong advocate for that from the get-go, stating that healthcare must be prioritized even when it comes to budgeting.